It has been 2 years since the health sector management was devolved to the counties in accordance with the Constitution, a process that has had its fair share of challenges, especially given the conflict witnessed between the health workers and the county governments that have often ended up in go-slows and strikes by nurses and doctors. As a result, some counties have suffered a mass exodus of doctors who leave the public sector, citing frustration by the devolved system. Nurses and doctors have often downed their tools over late payment of salaries and disputed allowances. All along, the governors have put on a brave face, blaming such challenges to teething problems and late disbursement of funds from the national government. It is because of these challenges that the Constitution Implementation Oversight Committee feels healthcare should be managed by the national government.
Many of our hospitals in the counties are lacking in basic medical supplies. Indeed, we met with a number of patients who told us that more often than not, when they go to the county hospitals, they actually send the patients to buy drugs for themselves in chemists.
But a section of senators feel the challenges facing the sector are merely administrative that could be addressed by forming a health workers commission instead of reversing the gains of devolution.
Hicho kipenge cha kujaribu kupendua katiba yetu ya Kenya ati turegeshe national government kwa ajili ya tumekosa suluhu baada ya miaka miwili ya devolution ni katika zile fikra zinazochangia kuvunja wa Kenya moyo katika masuala ya devolution.
So just like we did in education, there might be need for us to amend the constitution so that we create a health workers commission, just like we have the teacher service commission.
If the CIOC were to pursue the constitution amendment way to revert public health care to national government control, then according to Article 256 of the Constitution, a bill would have to be drafted and passed by at least 2/3 of the National Assembly and the Senate. The timelines are lengthy, as such a bill would only begin to be debated by Parliament at least 90 days after a first reading. If adopted by both houses of Parliament, the President would have to request the Independent Electoral and Boundaries Commission to conduct a referendum within 90 days. If supported by a majority of participating voters, the President would be required to assent to the bill within 30 days and have it published as law. It is only then that devolved health services run by county governments would revert to the management and control of the national government. Sam Gituko for Citizen Weekend.